So I've been a clinical researcher for about 20 years now. I've worked as a medical specialist in rehabilitation medicine for a long time, then did my PhD using a clinical project, and then I've been active in clinical research since. I particularly researched rehabilitation, disability, and recently it's been particularly rehabilitation and disability after trauma. The John Wall Centre for Rehabilitation Research has been known by that name for about 2 years. We've been going though since 1993. It's a research centre that's explicitly interdisciplinary. We're interested in rehabilitation and disability research, and we've named ourselves the John Wall Centre in recognition for the work of Mr. John Walsh, who's been a campaigner with reference to disability support, and he's been a prime mover in establishing the Australian National Disability Insurance Scheme. So we work with John on a regular basis as well, so he's a co-researcher with us now. We've got ongoing interests in research in the area of compensation health. This has been particularly in recovery from motor vehicle crashes, but the similar principles apply to work injuries and indeed other illnesses that might cause disability. So we've got broad interests in research and education in areas related to rehabilitation and recovery. That's our key area. I've been increasingly interested in compensation health over a number of years. We had the situation way back in 2000 where legislation around motor vehicle crash insurance green slips was changed, and at that time we did an evaluation of the effects of those changes to legislation, and we showed quite conclusively that health improved for people with whiplash after those changes. And so that's meant I've had a continuing interest in the area, and because we're close to having new green slip insurance legislation in New South Wales, I'm very interested now to see that the new legislation is put together in such a way that it's likely to help people recover better from motor vehicle crash injuries. The biggest difference between New South Wales and Victoria in terms of green slip type insurance is that there's a no-fault system in Victoria. You don't need to establish who's at fault. New South Wales you do. In most cases there are exceptions, and so that's the biggest difference. So there's a single government insurer in Victoria, whereas in New South Wales we have a number of private companies who provide that insurance. See whether the experience of injured people in New South Wales was different to those in Victoria. So the postdoctoral fellow, Dr. Nika Elbers, devised a study where we interviewed 100 representative people in New South Wales and 100 representative people in Victoria to contrast their experiences with injuries covered by those green slip insurance schemes. What we saw was extremely big differences in perceived fairness between New South Wales and Victoria. So about 80% of people in Victoria felt that the green slip type insurance was fair, whereas in New South Wales it was only about 45%. So these are really huge differences in this type of research. And so naturally we thought, why would there be a difference? And we think it's probably mainly having a no-fault versus a fault-based system, but there are likely to be other factors as well. For example, how recovery is supported by the different systems. So for the research, we interviewed a representative group of people from New South Wales and Victoria who'd experienced motor vehicle crash injuries. And so by talking to those people, we could get a contrast between the average experience in one state with the other state. We saw much bigger differences than we expected. I'd almost say I was shocked as a researcher to see how big the differences were. We got a big shock, and also the government regulator of insurance companies in New South Wales got quite a big shock as well. They saw it in a positive sense, in that there was improvement to be made in New South Wales, and so a number of the changes to legislation that have been recommended hope to address the differences in perceived fairness. So the main groups that we've presented the findings to are the government regulators in New South Wales and Victoria, and also to other interested groups. They tend to be health practitioners, people working in public health, people working in the insurance industry. So they've been interested in the results. We now have a publication about this in the peer-reviewed literature, and we're starting to get some wider interest following that publication. So we've established that there are these big differences in perceived fairness. We need to understand in more detail what's driving this. We are pretty sure that needing to prove fault in a system means that there's a greater perceived unfairness. There's likely to be other factors operating as well, and so we'll look at more comparative work between New South Wales and Victoria, and also potentially with other states, particularly Queensland, to try and tease out differences. Differences, for example, are likely also to be related to the support that people receive to recover, the support that people receive to return to work, and then also there'll be factors related to health practitioner behaviour that can be either productive or unproductive. So, for example, some of my medical colleagues need to be more attuned to recovery and minimising disability rather than looking for medical solutions to problems that don't have medical answers. Most people who've been injured want to get better as quickly as they can and get back to work. However, a number of people find themselves locked into a system that doesn't support that. So the system is either explicitly or implicitly saying that you need more time to recover, or that your pain needs further treatment, or you may find that there are family or work colleagues who are not that supportive in your recovery. And so financial incentives for non-recovery are there, but they're not explicitly driving people's behaviour. It's more that people find they're locked into a system that can be far from supportive.